Hi guys, welcome to Tony's tutorial. Today we are going to discuss an anatomy portion that is from the front of the thigh, where we had already discussed the femoral triangle, femoral sheath and femoral canal. Now we are going to something more important in our daily life and practical and clinical scenario, that is the muscles of the front of thigh. Of course, you know that in your clinical practice muscles do play an important role. And of course you need to know about the muscles. Definitely you need to know the origin, insertion, nerve supply and action of each muscles. Then only your treatment is going to give the best results. So let us study the muscles. I know all of you are learning it for the first time. Most of you are learning for the first time. So just listen. It is simple. And in the thigh region we have three compartments. That is the anterior compartment, where you have some group of muscles. Then you have the medial compartment, where you have that adductor muscles and so on. Then you have the posterior compartment, which is the back of your thigh region. In the front of the thigh, we will be focusing now on the anterior compartment muscles of the thigh. Medial compartment and posterior compartment we will be seeing later. So let us start with the anterior compartment muscles of the thigh. So the anterior compartment muscles, just let me write down the names. The first muscle is the Sartorius muscle. The second one is the Quadriceps femoris muscle. Quadriceps femoris muscle. The third one is the Articularis GENU muscle. Articularis GENU. Okay. These are the three groups of three muscles or muscles that are seen in the anterior compartment of the thigh region. Now, why did I leave a bit of space in the just below the quadriceps femoris? That is because quadriceps, that word denotes that is the four. So quadriceps femoris is a group of muscles. There are four muscles seen in the quadriceps femoris. That one is the rectus femoris. The second one is the vastus lateralis. Third one is the vastus medialis, and fourth one is the Vastus intermedius. Yes, okay. Just don't get confused. Vastus, just remember the term vastus. It is common in three. So one is lateralis, seen laterally. One is medialis, seen medially. One is intermedius, seen in between. So the quadriceps is a group of muscle, made up of four muscles. First one is rectus femoris. Second one is vastus lateralis, vastus medialis, and vastus intermedius. You have rectus abdominis in your abdominal region. Similarly, a straight group of muscle present in the thigh, that is the rectus femoris muscle. Then surrounding the rectus femoris muscle or surrounding the femur, you have vastus lateralis, medialis, and intermedius. Clear? So now let us start with the first group of muscle, that is the Sartorius. That is the Sartorius muscle. You might have heard the Sartorius is known as Taylor's muscle. Sartorius is known as Taylor's muscle. And it is the longest muscle in the body. Longest muscle in the human body. So the two features of the Sartorius, it is known as Taylor's muscle. This is the longest muscle in the human body. This you will understand later when we discuss the actions. And this is the longest muscle. It is, since it is longest, it is long, slender, and narrow. It is long, slender, and narrow. The muscle is long, slender, and narrow muscle. Okay? And then it is ribbon-like muscle. It is ribbon-like muscle. It is a ribbon-like muscle. Okay. Now the features of the Sartorius: it is Taylor's muscle. It is the longest muscle. It is long, slender, and narrow. It is ribbon-like. Okay. And the next one, it runs downwards and medially. It runs downwards and medially from its origin. It runs downwards and medially, or inferior and medially from its origin. Now, when we discuss every muscle, you need to know its origin, nerve supply, action. That is the important ones that you have to study. Let us study about the origin, nerve supply, action and insertion of quadriceps muscle. Yes. Origin, insertion, nerve supply and action. I think that nerve supply and action we will study later together when we study those all the anterior compartment. After discussing the anterior compartment, we will study it together. Okay. The origin is from anterior superior iliac spine. The origin is from anterior superior iliac spine and a groove and a notch below the spine, and a notch below the spine, below the anterior superior iliac spine. And its insertion is, this muscle starts from the hip joint, it crosses the knee joint and gets inserted. So it's a two joint muscle. It gets inserted in the knee, sorry, in the tibia. Where in the tibia? It inserted in the medial surface of shaft of tibia. See how long it is. It starts from the anterior superior iliac spine and it's inserted in the shaft of the tibia. That is why it is known as the largest muscle. So if we show in the with the bone, it starts from the anterior superior iliac spine, this region, and a notch just below the spine. See this notch, and it starts from there, runs like this. If we have the hip like this, let us just imagine this one. Let us hold it like this. Okay. Let us just place it like this. Yes. So it starts from here, comes like this, runs medially, and then travels to the tibia. And then not insert into the femur, but insert into the bone below that. That is tibia. The medial border of the shaft, medial surface of the shaft of the tibia. It is getting inserted in the shaft of the tibia. So such long muscle is this Sartorius muscle. Once again I will tell you, it starts from the anterior superior iliac spine and a notch below the spine, and it's inserted into the medial surface of shaft of the tibia. Yes, that's it. And the next muscle is the quadriceps femoris muscle. The next muscle group is the quadriceps femoris. In that, the first one, it is the rectus femoris. Rectus femoris. So rectus femoris is a two-headed muscle. It is having a straight head and it is having a reflected head. It is having a straight head and reflected head. So origin is from, where can you imagine? This is from the anterior superior iliac spine. So this, let us give it the anterior inferior iliac spine. Very good. Easy to remember. It starts from the anterior inferior iliac spine. That is a straight head. That is a straight head arises from the anterior inferior iliac spine. And the reflected head arises from the groove above margin of acetabulum, or the margin of acetabulum. Just remember, margin of acetabulum plus hip complex hip joint capsule. That is having, it has two origins. One is a straight head arising from the anterior inferior iliac spine, and then the reflected head arises from the groove above the margin of acetabulum and hip joint capsule. Where is it inserted? I want to tell you that all the four muscles in the quadriceps femoris group, that is rectus femoris, lateralis, medialis and intermedius, comes and have a common tendon. They inserts as a common tendon into the patella. Okay, mostly into the base of the patella. So this one gets inserted into the base of patella. It's inserted into the base of patella as the quadriceps tendon. A tendon is known as quadriceps tendon. Okay, that common tendon, it is a common tendon for the four muscles. So immediate, just remember, it is inserting into the base of the patella. Clear? Yes. And that's all about the rectus femoris muscle. Then you have the second muscle in the quadriceps, that is the vastus lateralis muscle. Vastus lateralis muscle. Very good. The vastus lateralis muscle. Now, the anterior superior iliac spine is over, and the two joint muscles are also over. This rectus femoris is also inserting into the knee joint. This quadriceps tendon moves over the patella and becomes patella tendon and gets inserted. So it's a two joint. Okay, leave that. And here you have the single joint muscle starting. That starts from, origin is from vastus lateralis, means it is seen in the lateral side, mostly in the lateral side. In the medial side you have intermedius, in the center you have intermedius, and here you have the medialis. Last we will draw a diagram, don't worry. Okay, now if you draw a diagram it's waste. Let us study the points, then we will draw a diagram. That's my way of approach. If your way of approach is different, you can do it the other way also. So the origin is from upper part of intertrochondric line, upper part of intertrochondric line, lateral lip of linea aspera, lateral lip of linea aspera, lateral lip of gluteal tuberosity, lateral lip of gluteal tuberosity, anterior and inferior border of greater trochanter, greater trochanter. See, this is the origin. That is from the upper part of this part, upper part of the intertrochondric line. Okay, lateral lip of gluteal tuberosity, lateral lip of the linea aspera, anterior and inferior border of greater trochanter. So this arises from this part. That is the vastus lateralis muscle. That is from the, this is the intertrochondric line, and the upper part of the intertrochondric line, lateral lip of the linea aspera, lateral lip of the gluteal tuberosity. This is the lateral side of the femur. Okay, lateral lip of the gluteal tuberosity, and anterior and inferior border of the greater trochanter. And it is inserted into, I told you that all these muscles are having insertion into the base of the patella. So the base of patella, exactly speaking, lateral part of the base of the patella. So you know that if you draw the patella like this, you have the patella, this is the, it is apex is pointed downward, this is the patella. So here you will have the quadriceps femoris, rectus femoris attached. Here you will have the vastus lateralis muscle attached. Here you will have the vastus medialis muscle attached. Here you have the vastus medialis muscle attached. So that is the base of the patella, and lateral part of the lateral border of the patella, and lateral border of patella, base of the patella and lateral border of patella. Okay, base of the patella and lateral border of the patella. Well, that's all about the vastus lateralis muscle. Okay, the next muscle over there is a vastus muscle itself. That is vastus medialis muscle. That is vastus medialis muscle. Now we had anterior superior iliac spine is over for here, anterior inferior iliac spine is over here. Here you have intertrochondric line. Here also you have the intertrochondric line. That is from the lower part of intertrochondric line. Lower part of intertrochondric line. This is from the upper part. This is from the lower part. That is from here, lower part of the intertrochondric line. Then this was from the lateral lip of linea aspera. This is from the medial lip of linea aspera. You can correlate and study, then it is easy for you. Okay. Then another difference is that it is from the spiral line. It is from the spiral line. So you have here a lateral lip, lower part of the intertrochondric line, then medial lip of the linea aspera, and from here the spiral line, medial lip of the linea aspera, and from the lower part of the intertrochondric line. Where is its insertion? It is also inserted into the base of the patella. Inserted into the base of, this is not working, sorry. Inserted into the base of patella. Inserted into the base of patella. See, that is inserted into the base of patella. Okay, and medial medial 1/3 of the base of patella. Exactly speaking, medial 1/3 of the base of the patella, medial 1/3 of the base of the patella, exactly speaking, and upper 2/3 of medial border of the patella, medial border of patella. No need to worry, this is also inserted into the medial border, medial part of the base, that is the base of the patella. In base center region you have the rectus femoris, here you have the vastus lateralis, then of course here only we have the medialis, that is inserted into the medial 1/3 of the base, as well as the medial border of the patella, medial border, upper part of the medial border of the patella. You know that patella has medial border, lateral border, superior border, etc. So when you study patella, you can study it in detail. Understand that is into the upper 2/3 of the medial border of the patella. And the last muscle group over here, that is in the quadriceps femoris, is the vastus intermedius. Vastus intermedius. Vastus intermedius. It is arising from, so intertrochanteric line is over, we distributed it equally over here. Now you don't have the intertrochanteric line. Let us take the shaft. It is from the shaft, that is the anterior and lateral surface of shaft. Lateral surface of shaft. That is from anterior and lateral surface of the shaft. So intertrochanteric line is over. Now you have the shaft only. That is from the anterior and lateral surface. Exactly speaking, upper 2/3. So it is having a long insertion, long origin. Upper 2/3 of the anterior surface and the lateral surface of the shaft of the femur. Anterior surface, lateral surface of the shaft of the femur. That is the vastus intermedius muscle and is inserted into the base of patella. Exactly speaking, you cannot see the vastus intermedius. It is just below the rectus femoris muscle. So it is inserted in the base of the patella, just below the insertion of rectus femoris. Just below the insertion. So you have the rectus femoris inserted over here, and below that rectus femoris you will have, this is the rectus femoris, and below that you will have vastus intermedius inserted into that common tendon. Clear? And the last muscle is in the front of the knee is articularis GENU muscle. Articularis GENU. This is these are muscular strips. You can call it as muscular strips. Not exactly speaking like these muscles. They are seen like the strips of muscles from the shaft of the, from anterior surface of shaft of the femur. You only have shaft left, shaft of the femur. Anterior surface of the shaft of the femur. Inserted into, where is it inserted? Into the suprapatellar bursa. It is inserted into suprapatellar bursa or synovial membrane. It is inserted into suprapatellar bursa or synovial membrane. So let us see where it is. This is from here, lower end of the shaft. We will have only few strips like this. One strip like this, one strip like this. That may be the articularis GENU. So it starts from the anterior surface of the shaft of the femur and is inserted into the suprapatellar bursa or the synovial membrane of the knee joint. Synovial membrane of the knee joint. Why is it inserted in the synovial membrane? We will see later. Okay? Sorry. So you had the muscles like a Sartorius, Rectus femoris, Vastus lateralis, Vastus medialis, Vastus intermedius, Articularis GENU. I would suggest you draw some column like this, make it into 3. Here you can write Vastus lateralis, Vastus medialis, Vastus intermedius. Origin, this is from the upper part of the intertrochanteric line, this is from the lower part. Just this from the shaft. Similarly, you can make a column and you can study insertion is in the same and action etc. are same over here for these muscles. So you can study by making columns. Now let us see the nerve supply. The nerve supply for all these muscles is from the femoral nerve. So that's over. That story is over. Just by remembering the nerve supply for all these muscles, Sartorius, Rectus femoris, Vastus lateralis, Vastus medialis, Intermedius and Articularis GENU is from the femoral nerve itself. That's all about the action. Now something that is important is the action of the muscles. Action of the muscle. Remember, Sartorius is a two joint muscle. So it will have action in the hip, sorry, action in the knee and action in the hip. Yes. Okay, what is the action? It involves the action of the Sartorius is, first one, it provides abduction. It provides lateral rotation. Always abduction is seen as a combination with the lateral rotation. Abduction and lateral rotation of the knee, of the hip. Abduction and lateral rotation of the hip and flexion of the knee. Flexion of the knee. So that is the function of Sartorius, abduction and lateral rotation of the hip and flexion of the knee. This is the position that tailors adopt. You know that the tailor sits like this in that machine, a tailoring machine, and they sit in a bit of abduction and a bit of lateral rotation and the knee flexion, and they do this one. They do their activities. So it would be like this. If you have the hip over here, I don't know if you can see my leg, so I'm just illustrating with. They will be sitting like this. This is the nodal position. I will go for some abduction, lateral rotation, and flexion at the knee joint. So that is the position. Some of you adopt this position for the prayer also. Remember that. That is why it is known as a Taylor's muscle. So the function of the Sartorius is the abduction and lateral rotation of the hip and flexion of the knee joint. Right? And the next muscle is rectus femoris muscle. Rectus femoris muscle. The group of quadriceps muscle. Their common function is the extension of knee joint. Their common function is the extension of the knee joint. Extends the knee joint. And this is rectus femoris, two joints of origin. Then therefore it flexes the hip. Flexion of hip. So the function is opposite to each other, because if it extends the hip, extends the knee, it cannot extend the hip. So what is happening is it causes a flexion of the hip and extension of the knee. Flexion of the hip and extension of the knee. Clear? That is the function of rectus femoris, extension of knee and flexion of the hip. Then you have vastus lateralis. Since it's a group of quadriceps muscle, their function is extension of knee. Extension of knee. Other function is it helps in standing, walking, etc. It helps in standing, walking, etc. This vastus lateralis has a great role in our normal stance phase and walking phase, which you will study later in your gait chapter. But just remember that this muscle helps in standing, walking, etc. That is in the extension of knee. And vastus medialis also helps in the extension of knee. Extension of knee. Then it has a unique function. It helps in the locking mechanism of knee. Locking mechanism of knee, which you will study in the next chapter, but you just remember in the biomechanics, that is the locking mechanism of the knee. It helps in the locking mechanism of knee and lateral displacement of patella. It prevents the lateral displacement of the patella. So the patella over here, it can get displaced laterally. So that is prevented by this medial group of muscle known as the vastus medialis. The function is extension, locking mechanism of knee and lateral displacement of the patella. And what can I write? Let me write it here. Vastus intermedius muscle has only one function, that is in the extension of knee. Extension of knee. Vastus intermedius muscle also helps in the extension of knee. And the last muscle is our articularis GENU muscle. What is its function? It is attached to the synovial membrane and suprapatellar bursa. So it pulls the synovial membrane upwards. So this muscle from here, it pulls the synovial membrane upwards during our extension phase, so that the synovial membrane do not get compressed between the joints. So that is the function. It pulls the synovial membrane upwards. So it pulls the synovial membrane upwards. Clear? That is all about the muscles of anterior of the thigh region, the anterior compartment of the thigh. Remember, there are four muscles or three muscles mainly, that is the Sartorius muscle, quadriceps muscle and articularis GENU. Quadriceps can be a short note and it can be a question because it is made up of four muscles. Quads means four. That is rectus femoris, vastus lateralis, vastus medialis and vastus intermedius. All these muscles has a common function of the extension of knee. In the rectus femoris is two joints, so it will have a function in the hip, that is flexion of the hip. Similarly, Sartorius has a function of abduction and lateral rotation, but it's a two joint, so it has a function of the flexion of the knee joint. The other one is the extension of the knee joint. And the articularis GENU is a small group of muscular strips. They are just seen as strips of the muscles like this. 2 or 3 strips of the muscle, and their function is they are attached to the synovial membrane and pulls the synovial membrane upwards. Now if we evaluate the anterior of the thigh, then when we studied the femoral triangle, we saw about iliacus, pectineus, adductor longus, etc. You might feel that this comes in the anterior compartment of the thigh, but this iliacus and the psoas major role are the abdominal muscles, so you will study later, but they have a role in the hip, no need to worry about that. Adductor longus, etc. comes in the medial compartment, we will study that later in the next session. So let us wind up this by remembering the muscles in the front of the thigh or in the anterior compartment of the thigh. Remember, Sartorius is the talus muscle. Remember, rectus femoris is the kicking muscle. This muscle helps in the kicking, that is in the kicking muscle. And Sartorius is the longest muscle, and rectus femoris is bipinnate muscle. If you ask, somebody asks you, rectus femoris is the bipinnate muscle. So stay tuned, subscribe to my channel, and see you later with the next topic, that is the adductor canal. Thank you.